So last time we closed on marijuana and how endocannabinoids work, similar to THC, which is the active compound in marijuana. And again, THC, that's the active ingredient, so tetrahydrocannabinol, that's going to be the active component of the marijuana plant. And it's going to be a metabotropic type activation of the cell. So again, with metabotropic versus ionotropic, it's going to be a little bit slower in terms of onset and its activity. And CB1 is going to be one of the major receptors here. It's going to affect areas of the brain, including the caudate, putamen, substantia nigra. And what does it do to the body physiologically? It's going to affect psychomotor control. So that's going to be effects that it has in the basal ganglia, right, in terms of like regulating movement and whatnot, as well as the cerebellum, which helps to control movement, right, control and smooth out movements. It's also going to affect the hippocampus in terms of memory, and it also affects the hypothalamus in terms of feeding, right? So that's why, especially the last part over here, that's why marijuana can be used to help treat people who have issues with hunger, right? Cancer patients, for example, they lose a lot of weight. They also sometimes have diminished appetite. And so to be able to stimulate appetite, THC has been used to help those types of patients.
Can it also do the opposite?
Reduce hunger?
Yeah.
I think that has to do with CBD. So from my understanding about the way CBD works is that CBD does like the opposite when it comes to hunger. So if you had...
It doesn't from not personal experience.
So like from people that I know that worked in the industry, they say that to balance out the hunger effect, if you have THC, but then you also couple it with CBD cancels that out. So that's from what I heard from people that work in the industry, but I don't know what the research is on that. And I don't even think there's really that much research on it to begin with. There's still more and more research coming out in terms of THC and its effects. So, have you guys seen this movie before, Reefer Madness? Yeah, it's a classic. I think it was made in the 1950s, if I remember correctly, but absolutely hilarious. Marijuana is actually not, of course, the original name of cannabis. It was cannabis sativa. And early 20th century, during like Prohibition era, the powers that be wanted to figure out a way to really like demonize and stigmatize the compound. And in early 20th century, I guess people had an issue with the Hispanic community. And so, so they named it marijuana because marijuana sounds Hispanic, right? It sounds Spanish. And so they wanted to kind of like, make this associated more so with like certain minority communities, right? So pretty dark stuff because cannabis was perfectly legal up until the early 20th century. As a matter of fact, some of our founding fathers grew cannabis. They had hemp plantations, they grew cannabis. So it was part of like early American culture up until the early 20th century. And then you had this massive Prohibition era, and now we've come out the other end of that. Kind of interesting to see how the drug laws have evolved.
I also heard that they not only did they like make it a Hispanic thing, but also that Hispanic people use it the least out of everybody.
Really?
Yeah, like when they would do surveys, it was like predominantly white people who use marijuana. And they somehow were able to like change schemes.
That's so funny. It doesn't surprise me whatsoever.
Anecdotal experience, that is still the case.
Yeah, that's so funny. So here's the cannabis sativa plant, right? That's where you get tetrahydrocannabinol. And it's going to affect different parts of the brain, including the caudate, the putamen, the hippocampus. So really, really interesting compound, used for multiple different purposes, right? Some people use it as a sleep aid. Some people use it for stimulation of appetite. Some people use it to treat pain, right? So it can have some analgesic type effects as well. And recall that you have a retrograde type effect on this. Like when this THC is actually released, or even just endocannabinoids, they have a retrograde type effect, right? It's going to be released from the postsynaptic cell, enacting its effect on the presynaptic cell. And then effectively it blocks GABA, and that's one of the major effects of it. And so here's a couple studies that show if you block the effect of endocannabinoids, it basically reduces iPSCs, the inhibitory postsynaptic currents. So it's a little demonstration of the study of certain studies that show the effect of endocannabinoids. Now let's switch gears and talk about nitrous oxide, because nitrous oxide does a lot in the body. One thing that it does in particular is it helps to vasodilate. But it can also have effects on the CNS as well. And that's where it comes into play in, for example, dentistry. Right? Nitrous oxide is going to be one of the analgesic compounds that are used in dentistry. How does it work? Effectively, it's going to allow for guanylate cyclase and cyclic GMP to be released. And it can also help to regulate other types of neurotransmitters. When you see GLU, that means glutamate. So it can help to regulate glutamate as well. And this is an image that I put here. This is a nitroglycerin tablet. This is what you would give a patient who has pectoral angina, which is chest pain, often due to narrowing and sclerosis of the coronary arteries. And so those types of patients, if they have a stable angina, for example, as soon as they start going up like a flight of stairs, or if they're doing any sort of strenuous activities, they can start getting some severe chest pain. It feels like a heart attack. And so to be able to alleviate the pain from angina, you can just pop a sublingual nitroglycerin tablet. It goes through the central vein down to the heart, and then it makes its way to the coronary arteries, and then it dilates those coronary arteries. And so now you can start getting better perfusion of oxygenated blood throughout the heart. And then you can carry it around in these little tiny dispenser pill vials. So lots of patients with angina will have this like as a keychain, right? So whenever they feel chest pain, they can take this. And it has a pretty rapid onset. So once they start feeling the chest pain, they pop the sublingual pill. And like I said, it goes directly to the bloodstream. So very effective treatment in angina. So nitrous oxide, in short, dilates blood vessels. It can also help tissues, like damaged tissues from like low blood supply. It can help those get repaired, right? So if you increase blood supply to areas that are damaged, you're going to get better effective wound healing as a consequence. You can also see other things happening with the CNS, right? So it can cause dizziness, disassociation, disorientation. It can also affect your balance, your memory. It can affect your cognition. It can cause weakness, right? And so it does have, what would you call it? It does have like abuse potential, right? When I was doing my surgery and pediatrics rotations in the UK, people in the UK absolutely love whippets. And the first time I walked down, because they do a Sunday market down Brick Lane, which is where I lived. I lived in Bethnal Green, and I was right on Brick Lane. And Brick Lane is like this like really cool old area of London. And they do a Sunday market. And the first time I was walking down the street, I was seeing all these CO2 canisters, like all over the place. And they would just like litter the streets with them. I'm like, what the heck is going on here? This is totally insane. And there was this like really pretty park, and like it was summertime, and summertime in the UK is beautiful. So the people were just all over this park doing all sorts of drugs, including a lot of whippets, and just like littering the city streets with these things. Yeah. It gives you like a disorienting effect. It can also have like it almost can be like kind of like a psychedelic effect as well. And it's very short-lived. So that's why when people like take this, it lasts maybe like 2 minutes. And so you keep on doing it over and over and over and again.
I was just thinking that. It's like, yeah.
Sort of. But you put it into I think it's like for bakers use it. It's like a CO2 type canister. And like, it's pretty intense for the first minute or two. And then you have to keep on doing it to achieve the same effect. It's interesting. And it's also used by dentistry, right? This is like the laughing gas that you would use to anesthetize your patients during dental procedures. So it's a very interesting compound. And it's been used for a very long time. I mean, this is an illustration from the 19th century of these like Victorian loons with their top hats just like getting high off of nitrous oxide. So it's been around for a while, and it's been used for a while, even recreationally. So very interesting stuff. Don't worry about the cellular mechanisms and the cascade of nitrous oxide. So you get, nitrous oxide allows for guanylyl cyclase to create cyclic GMP, and then you get protein kinase G, and that elicits its effects downstream. So, but don't worry about this whole cascade. Just kind of have a general understanding of what nitrous oxide does. All right, let's do a couple quizzes questions, and then we're going to switch gears to the next topic. So we'll do like maybe one or two of these, and then you can do the rest of these on your own time. So let's go ahead and log in. And if you haven't done so already as well, like please download 6.4 so that you have the updated version of that.
Wait, so is the main reason that nitric oxide is like an advantage in dentistry because it dilates blood vessels to promote healing?
No, it's because it's a dissociative.
Okay.
It's like a dissociative anesthetic, basically, in higher doses. So it'll like it will just kind of like knock you out. All right. Good. For those of you who chose tryptophan, psilocybin, tryptophan 5-hydroxylase, what was the rationale behind choosing those options?
I could not remember what was 5-HT.
Okay, fair enough. Fair enough. 5-HT is the serotonin receptor. And LSD is an agonist on the 5-HT receptor. Psilocybin is also a agonist on the 5-HT receptor. Tryptophan is a precursor for serotonin. But the main thing here is that it says which substance is a neurotransmitter, meaning that it's something that's produced by the neuron packaged into a vesicle to allow for exocytosis. The only one here that fits that definition of neurotransmitter is serotonin. These other ones are going to be compounds that enact their effect on the 5-HT receptor, but they're not neurotransmitters. They're exogenous compounds, basically. One more. Okay, tryptophan, like I just said a second ago. Tryptophan is going to be the precursor for serotonin, but tyrosine is specifically the precursor for dopamine. Dopamine, but also your other catecholamines too, right? Because tyrosine eventually turns into dopamine, which eventually turns into norepinephrine, which eventually turns into epinephrine. So it's all part of the same similar cascade.
And that's why they have people with Parkinson's eat tyrosine or foods that have that in it.
I guess so. Yeah, I'm actually not familiar with that. I'm not familiar with that, but that would make sense.
I think I saw that. I could be wrong. But
No, that would totally make sense if that was the case. So, yeah, absolutely. Let's do one more. So ionotropic opens ion channels, right? It's going to be faster acting, right? Whereas metabotropic, it's going to involve G-coupled proteins. And so those are going to be a little bit slower in their effect. So it looks like most of you guys got that one correct, which is good. All right, I'm going to end it there, and then we will continue with 6.4 now.